Hi nurses. In today's video, we are going to talk about one of the most important safety checks assessed in OSCE stations, which is about the medication safety. So let me take you through the 6 or sometimes there are 7 rights of medication safety. So let's go through each of them. First right is that you have the right drug in your hand. And that is make sure that that is the right drug which is prescribed and you have right drug in your hand, including its expiry date. Secondly, make sure that you have the right route. So I've got tablets here which is given orally. Make sure the drug that's prescribed is oral. Right time, that you can see that this is the right time to administer this drug on the medication chart. Right patient, very important. Before you start with anything, make sure that the chart belongs to right patient and you have correctly identified your patient using 3 identifiers. And then you want to make sure that you have the right dose. So as prescribed by the medication on the medication chart, you have the right dose in your hand, and then right documentation. Make sure that you have a valid order and signed by a prescriber and with their name legible and with their contact number. Okay, and then another right, some of the health services and some of the states, they use this, they have this right mentioned. It is right to refuse. That also is important when you ask your patient for a valid consent, a verbal consent. Make sure that they do have a right to refuse. So let me put it all together. I've got a drug here. So I want to make sure that I check all these 7 rights. So I'll confirm that I've got the right patient. I'll check patient's full name, date of birth and address and confirm that that's correct. Then I will check that I've got a drug order which is legible. So I've got Ramipril and today's date I've got it like a route as an oral drug, 5 milligrams daily. I've got it written as time for now, and there is an indication here and it is being signed by the medical officer. So I've checked the make sure that I've got the drug that's available is the right dose, 5 milligrams Ramipril, and then I check the expiry date. It's very quick to do 7 rights. And when I check patient's ID, I also confirm that they are okay for me to prepare this drug. And if patient agree to it, then I've also made sure that I've checked the 7 right of their right to refuse. So very easy process. You are assessed on this knowledge of medication safety in your medication administration station. So make sure you always follow these 7 rights and do it correctly. Thank you.